So this is an open discussion. We've got a few thoughts and areas that we wanted to focus on, and it should be an open dialogue. So anyone that would like to engage with the panelists, don't hesitate to raise your hand and get our attention. But one of the things that we're pretty sensitive to is, and I mentioned it a moment ago, is that we're creating openly and transparently a for-profit entity to help accelerate the mission of treating corneal blindness and corneal therapies broadly. How sensitive is that? You know, what's our view about, you know, is that going to work, or is it going to be drawing a lot of criticism and so forth? Audrey, what are you thinking in that area?
In terms of treating?
Yeah, a for-profit, you know, a for-profit entity that's now involved and will be handling tissue and providing tissue, et cetera. Any concerns about that?
Well, I think that one of the things that should be extremely clear is that the corneal graft is still a donation. Yeah. So the cornea is still a donation, and so people are not being charged for the cornea per se, right? There's no charge. There is a charge, however, for the processing fee. And just as surgeons, we charge for our services, right? We don't do surgery on a regular basis for free. I mean, you can donate your time and such, but in a like manner, there is a processing fee, and it's through the processing fees and having a for-profit subsidiary, kind of similar, if you think of it, to an already existing for-profit subsidiary, and that being Ocular Systems, which is yes. The endoserter. So there is a charge for the endoserter, and that is a for-profit company. And the great thing about that is that then the profits that are realized from there can then be used to have our ultimate goal, which is to treat corneal blindness and to eliminate corneal blindness worldwide. Yeah. And without those profits and without that kind of innovation, you know, we can trickle along.
Yeah. Dick or Steve, any other thoughts on that?
Sure. I mean, I think the cornea field has been somewhat neglected, particularly on the device side, as far as investment in innovation. And I think this is going to be a wonderful solution. An example, perhaps a brief example, I serve on the board of the University of Minnesota Foundation. That foundation has $2.2 billion, and they own several for-profit subsidiaries. We, for example, manage about 15,000 units that are rented to students on campus. That's a for-profit subsidiary that serves a positive purpose and also generates revenue for the University of Minnesota Foundation. We found multiple companies based on our faculty's inventions and help capitalize them and then get a return on that, which is also in a for-profit subsidiary of the University of Minnesota Foundation. And the wonderful thing is that all this innovation basically comes back to the mothership, in that case the University of Minnesota, to help them pursue their mission. And in this case, it'll go back to SightLife to help them pursue your mission.
Exactly.
Yeah, it makes sense to me. I think it's a logical partnership. There's a lot of things that a for-profit can drive. Innovation is one, economies of scale, enough eye banks should achieve critical mass to help with reimbursement issues. We've always had this trouble getting the tissue reimbursed. So there's a lot of areas that I believe it really will help with. So to me, it's very logical.
Let's talk a bit more about innovation. One of the frustrations I've had in the broad field of cornea is the lack of innovation, and I've had the good fortune of working on so many projects to marshal resources to focus on innovation. Innovation has to be rewarded, and so it has to solve a big enough problem that, you know, the resources, both human capital and financial capital, can be honestly rewarded. And In some ways, we're fortunate that the served market of corneal transplantation in the advanced markets in countries is modest in size, but it also means it's too small to attract strong investment. And when I was helping build AMO in the early days, I got interested in the cornea, and we did epikeratofakia. We started cutting the cornea and freeze drying and, trying to, so we were fussing around trying to innovate related to the cornea. And I got interested in the cornea, but also in storage media, because, how do you keep the tissue viable? And I wanted to, at AMO, I wanted to develop a corneal storage media, but when I ran the numbers, I couldn't convince myself or my team that it was worth the resources to do because the market was too small. First product we had with Chiron Vision was Optisol. Dick Lindstrom and Herb Kaufman and I sat in a hotel room and we wrote out the ingredients. And here it is, a couple years later. Still the leading corneal storage preservation. I mean, in some ways, that feels kind of neat that we invented that and developed it, but it also is a sad situation. Think of all the progress that's been made in the field of biology and tissue and biosciences and all of that. And here we are using the, quote, best-in-class media that was invented and developed nearly 40 years ago. That says that innovation in that field has been stalled, and shame on us if we allow that to continue. So innovation, how are we going to bring innovation back? Steve, you've been involved in many projects, Dick and Audrey, each of you as well. What's your thinking? What are your ideas?
The innovation cycle starts with an unmet need, which we have many in the cornea field, but it's fueled by financial and human capital. I mean, the fuel for the innovation cycle, which creates anything you think of that we have today that we didn't have 10 or 20 years ago, all of that was fueled by the investment of human and financial capital. And so if we want innovation in the cornea, someone has to provide that fuel. So if you go to Allergan or Alcon and you talk about a product that might generate $10 million or $15 million in global revenues, they're not interested in doing that. And so it isn't that they don't care, it just doesn't meet their scale. And so what we're going to be able to do is a new storage media might generate $10 to $15 million in global revenues, but the impact that it will have on the outcomes that corneal surgeons and patients achieve will be great. And we need better anti-fungals in our preservation media. There are agents that can probably extend the duration of preservation that would allow us to better send excess tissue abroad and create a global network of eye banks. We now have 80 in the US that collaborate well, but why not have 200 around the world that collaborate well and share tissue? We're going to have that, as well as the surgeons, to basically resolve this corneal blindness issue. No one else, and I think that's really why we've stepped up to some extent. It really is a mission-based thing. We haven't been able to find anyone else who's willing to invest the financial and human capital to do it. So we're going to do it.
Very good. Monty, what are you thinking?
Well, on the innovation side, I hear so many great ideas from corneal surgeons, and over the years, it's always been frustrating that we couldn't actually make them real. We didn't have the resources to really get them in action so that their patients could benefit from those ideas. And so I feel like we are now supercharged to take those ideas, take the patient needs, bring them into SightLife Surgical, where we are going to have the financial capital and the human capital to make these things a reality. We're just getting started. We're kind of getting organized and getting our feet under us, but we will develop a robust, disciplined process so that we are driving innovation. Steve, you might mention a little bit of your thoughts on cornea inlays and onlays. this is an area where I think donor tissue can be a really exciting part of making sure I don't have to have glasses in a couple years. But but I think it could be a really exciting part of actually helping people benefit from the refractive benefits that come from inlays or onlays. But again, it's somebody's got to be the catalyst to really make it come to bear.
There has been a lot of surgical innovation on the surgical side in cornea. If you're doing DSACs, if you're doing DMEX, that's just in the last few years. Inlays, onlays, cornea tissue in pockets for building up corneas with keratoconus for retreatments. There's all these different ideas, but there really hasn't, that immediately calls into need for somebody to supply those tissues. It's the different preparations of the cornea, getting maybe more than one use out of a particular individual cornea that's been donated. It would be completely, again, logical to me if you had a tight group of cooperating eye banks that were able to readily supply a specific piece of milled tissue for what our needs are.
I also think that it's time to really think outside the box in terms of cornea. Just as we have seen a transition with cataract surgery from a functional procedure to a refractive procedure over the last decade or so with the advent of new IOL technology, there's no reason why when we have the largest refractive surface in the entire eye, the cornea, why we can't make corneal surgery and corneal transplant surgery into more of a refractive procedure, where we are not just restoring functional vision, but we are also creating very, very useful and better, truly better vision for the patient. And with this sort of innovation and atmosphere, I think that we can be able to take a look at these things and to have an effect and to really be a market disruptor here.